and the Department of Health and Social Care sets out a budget to spend on the NHS. Each integrated care board, of which there are 42 across the country. If I just go on to the next slide, the diagram on the left demonstrates the integrated care board. There are 42 integrated care boards across the country, and these allocate funds. And these integrated care boards allocate funds based on the needs of that area, of the population in that area. And these can be towards primary care, so general practitioners, some dentistry services, some pharmacies, and some eye care as well. Hospital trusts, which are our secondary and tertiary care. So we have district hospitals in our smaller places, and then tertiary care or teaching hospitals in the bigger cities. And it also can fund home visits by nurses, especially to the elderly, social prescribing to groups to help people get back on their feet, and public health. So, yeah, as I said, this on the left is a diagram of our integrated health care boards, and on the right they are all of the hospital trusts, so all of the secondary and tertiary care centres in the country. There are some key bodies which are involved in running the National Health Service. I want to start with the body at the bottom, NICE, or the National Institute for Health and Care Excellence. These are responsible for determining which treatments we provide in the NHS. So a very key principle is the use of evidence-based medicine. So each treatment on the NHS has to be financially, we have to be able to provide it financially. And the way that we work this out is by using quality adjusted life years. And so the quality adjusted life years are a combination of the amount of years this would add to a person's life and how much it would add to their quality of life. And so the amount in the UK is £200,000, which I think is about 4 million Nepalese rupees, and that's the amount that a treatment has to cost under to be able to be used for the NHS. We also have some other bodies, like our public health body, our Care Quality Commission, which visits the different trusts and determines whether they're working as they should do, and then our General Medical Council, which monitors if doctors are performing as they should do, and the Nursing and Midwifery Council. So who is in charge of the NHS? So the NHS trusts all have a board, which include people from management, so CEOs and CFOs, as well as a chief medical and nursing officer. So each trust board has to have at least one doctor on the board. They also have, and then as we go down into the hospital organisation, it's very similar. So you've got divisions like medicine, surgery, women and children, clinical departments, and then at the ward level, you obviously have all of the multidisciplinary team. So how do patients access services? So no matter the amount of tax that you pay into the government, which is based on your income, everybody has access to the same services. And a key point for the NHS is that it's free of the point of use. So anybody can walk into a A&E department and receive care. So the way that this is organised in the UK is through the NHS Constitution, and this outlines what patients are entitled to and outlines what staff are entitled to. So some of the key points that patients are entitled to include being able to access the NHS free of charge, being able to be treated with dignity, accept and refuse treatment, and they have the right to consultant-led treatment within 18 weeks of a referral from a GP, and within 2 weeks if the GP suspects cancer. And then on the flip side, staff rights include working in a safe environment, being treated fairly, and there are other staff rights including our working hours and things like that. And then we also have some core values just to help keep up staff morale and keep like the big organisation working as it should be. So I also wanted to talk here today about some issues that we're facing in the NHS. It's one thing that the UK is very proud of, having a healthcare service that's free at the point of use, but there are some constraints in our healthcare system that is limiting use for the population. So we have a bit of a workforce crisis, particularly in the more rural areas of the UK, so not in the big cities, where we don't have enough nurses and healthcare assistants to help. And so we really do rely on many people from other countries, the European Union and from further afield to supplement our workforce. But also have a massive problem with waiting times, because everybody can access the NHS. There's a big queue in terms of when you can get your operation. So for example, if you tore your anterior cruciate ligament in your knee today, you would have to wait 3 months to get an MRI scan to be able to diagnose that that's what you've done, even if the clinical signs are highly suggestive. And then you'd have to wait a year or longer to get the operation to fix that anterior cruciate ligament. So the waiting times are very long. And then there's also some funding and financial pressure. The NHS, because it's a nationwide system, there's not much competition between different services and different insurance companies that patients could pay for. So they tend to spend more than they need to on services. And then we have a massive problem with the ageing population and multi-morbidity. 25% of the UK population is above 60, and most of these people live alone and they live far from their younger members of the family. So a large proportion of the NHS budget is going on caring for our older population. So there's further services that need improving, such as mental health. There's a big mental health crisis amongst young people, especially as about 14% of people between 16 and 25 are unemployed in the UK. It's really hard to access a GP appointment. It can take months to get a routine GP appointment. Social care, lots of patients, especially the elderly, will be stuck in hospital wards without a safe place to go home to. And we have some public health problems such as obesity and smoking and alcohol, which are costing the NHS a lot of money. So to end with, I just wanted to suggest some ideas for improvements. So, for example, for waiting times, we could have better access to GP appointments, more GPs, and that could reduce the amount of people in A&E attendance. We could have better social care integration, so more people and more access to social care services, or some elective surgical hubs that are separate from the hospitals that could decrease the waiting time. In terms of demoralised staff, having enough staff that means that everybody can get breaks, having flexible working options. We have these things called Schwartz rounds, which is where staff can share their thoughts and their problems that they've been having during the week, and having consistent teams, because at the moment your team will change pretty much every day or every month. So if we have more consistent teams, I think it will improve the morale of the workforce, because they know who they're working with and what everybody's capable of. In terms of the ageing population and multi-morbidity, it's really important that we integrate this with social care, and we find a way, because at the moment a lot of our elderly population are visiting a cardiologist for their blood pressure, an endocrinologist for their diabetes, an orthopaedic surgeon if they've had some problems with their osteoarthritis. And so we need a way to be able to have maybe like a new speciality or added to a GP speciality to incorporate all of these factors together. And then in terms of the mental health crisis, better access to non-pharmacological interventions. It can take over a year to be able to access like a counselling service on the NHS. And so lots of people are just getting put on antidepressants rather than being able to talk through anything that's been going on. And then again, early intervention at the community level. So that's everything.